How to use the sacket. The integrity of the cuff and inflation system should be checked prior to insertion. Remove air from the cuff prior to intubation. Once the length of the tube has been determined, cut the tube to the length desired. When cutting the tube to length, do not cut close to the joint between the inflation suction line and the main body of the tracheal tube, as blockage or leakage of the inflation suction system may occur. Firmly insert the 15mm connector provided into the tracheal tube. Do not use lubricants to assist with the insertion of the connector, as disconnection may occur. Once the patient has been suitably prepared for intubation, the patient is pre-oxygenated and anesthetized in the usual way. Check the patient is adequately anesthetized and ensure all necessary equipment is available. The laryngoscope should be gently introduced through the open mouth and the blade aimed towards the right-hand corner of the mouth. Advance the tip of the laryngoscope blade towards the posterior pharyngeal wall, sweeping the tongue to the left in the process. Position the tip of the blade in the vallecula and lift the laryngoscope upwards in line with the handle to lift the epiglottis. Expose the glottis and enable visualization of the vocal cords. With the vocal cords visible, gently pass the sacket through the vocal cords into the trachea until the intubation depth mark is at the vocal cords. Connect the ventilation system to the tube and inflate the cuff with the minimum amount of air to provide an effective seal. The cuff pressure should be regularly monitored and maintained between 20 and 30 centimeters of water, for example, using the Smith's Pressure Easy device. Suction secretions from above the inverted cuff using the minimum suction pressure necessary to effectively remove subglottic secretions. Suctioning may be applied either continuously at -2.7 kPa or 20 mm of mercury, or intermittently using a sterile syringe. If resistance is met on aspiration, flush the suction line with either air or sterile saline and aspirate again. Patients receiving long-term ventilation should be adequately humidified. Please refer to the instructions for use for further details.